Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about what symptoms should you never ignore after having knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications, and you can catch all of our latest videos related to knee replacement surgery, frequently asked questions, exercises, and much more. So let's go through this list. So first one is symptoms that may show signs of possibly having a blood clot or a DVT or a deep vein thrombosis in your calf and your lower leg. So what are some of these symptoms? One is throbbing or cramping pain in your lower leg and calf, swelling excessively or a new onset of swelling, feelings of warmth or redness of the skin, noticing swelling or swollen veins in your lower leg, or extreme significant pain when bending the foot. Now, a lot of these things are probably common symptoms just after knee replacement surgery. If you think about it, cramping, pain, swelling. But if you start to notice these things in a combination and they're not getting better and they're very significant, definitely worth talking to your doctor about it and consulting with them. Furthermore, a DVT or a blood clot in your leg can break off and travel to your lungs and become what we call a pulmonary embolism or a PE. And this is a blood clot that's traveled to your lungs. And this is a very serious complication. It's a medical emergency. So what are some signs of that? Significant shortness of breath, chest pain, feeling of lightheadedness or dizziness, a very rapid pulse, or coughing up blood. So any of these symptoms, if in doubt, again, reach out to your doctor. Better safe than sorry. What are some other things to be aware of? One is a fever. So having a high fever after surgery can be a sign of an infection in the knee joint or somewhere else in your body that definitely needs to be managed and taken care of efficiently. You also want to look at your incision after surgery. So making sure there's not any foul odors or a greenish or kind of purulent discharge from the wound. That could be a sign of a superficial infection to the incision and to the wound itself. And some other things besides just the knee itself to look at are things like constipation, nausea, and vomiting. These are all things that can definitely be addressed through appropriate medications or other management strategies, so it's definitely worth talking to your doctor about it. And then something a little more on the mental health and well-being is feelings of depression, feelings of anxiety, helplessness, loneliness, isolation. These things are all very important to take care of and to address. Addressing these things early and in a positive way is going to help you, one, be safe and recover safely and prevent any further complications or issues, but it's also going to help you recover and feel better and get better much more sooner and more efficiently. So definitely be aware of these different symptoms and don't just ignore them after surgery. Be sure to reach out to your doctor, your healthcare provider, so that the appropriate means can be taken to positively manage and address these different things. I hope you found this video insightful. Again, please be sure to subscribe if you don't already. Please be sure to leave your likes and your comments and questions below, as that helps spread this video to others who may benefit. Thank you for watching.